Janak Joshi, thank you very much, sir.
This is a government easel.
I hope you can hear me. I'll keep this a little close by. I don't have slides, but I would like to just show how one aspect of the Obamacare is working or not working, and how this thing is so convoluted and interrelated. Everything else is going on in Obamacare. You probably have started to hear about hospital provider fee, which we all call hospital provider tax, because by all means it is a tax. The way this was all begun, so if you take Obamacare, it has so many different things in it, and I hope one of our speakers, Linda Gorman, has a very interesting slide. Maybe she would show us again, and you can see how many things are in that Obamacare. So I'm only going to touch, because of the limit of the time, one aspect of it, and then tell you how it's all interrelated. So this thing was passed before I was elected. Louder? Okay. This thing was...
Thank you. Do you have a black marker?
Yeah, I do. So this thing was passed before I was elected. This bill was basically beginning of the Obamacare in Colorado and everywhere else. Thanks. This also added the Medicaid expansion and many other things. So the way this thing works is we passed a tax on the hospitals. They called it fee. Every day a patient is in the hospital bed. Initially it was $149 that would be charged for that. And every time you go to your doctor's office or the hospital to have a blood drawn or x-ray, etc., there was going to be about 50 cents on that. By doing this, they were going to raise somewhere $200–300 million. And then they would go to the federal government. Federal government gives them a matching grant. This becomes part of a big pot. The HICFA, or the healthcare finance, which runs the state Medicaid and the health system, they would take top somewhere in the range of about $48 million or so to run the program, and then the money will be distributed back to the hospital for providing Medicaid and uncompensated care. So the goal was good, except the way the whole thing was set up was a scam. So if I just make it a lot more simple, so the hospital will pay a tax of $1, for example. You go to the federal government and say, give me $1 because we raised $1. Now we've got $2. The department would take, say, 10 cents. So now you got $1.90 left. What they would then do is give this dollar, which the hospital had paid in a tax, back to the hospital. And then they would have now extra 90 cents to do whatever with it, basically give it back to the hospital. I have been looking at this thing ever since I got elected. And there is a story, and we don't have a lot of time today, so maybe that will be for another day. But this year, I actually asked this question, and the staff member from the Joint Budget Committee during our budget hearing process told us this is how it works. The hospital has $1 on Tuesday. The dollar is to pay their bills. So on Friday, they have to make a payroll, they have to pay their bills, etc. So the hospital gives the state treasury $1 on Tuesday. State keeps the money until 11:59 on Wednesday and gives the money back to the hospital. So now the state can show they had $1 from the hospital on the state books. Then they take that information, go to the federal government, and say, we raised $1. Now you give us some matching money because that's what the federal government has agreed. And they give them another $1. Once the dollar comes back, now they got one free $1. So this is like, I come to Bentley and say, hey, I'm going to give you $1. He goes to Don, says, I got $1, now you grant me another $1. He gives me the $1 back. Now he got $1 from Don, who is a taxpayer. This is exactly how it is working. So there are a couple other caveats to this thing. The bill says this will not be shown on a patient bill. There is one line in the bill. So none of us knows that the hospital is being taxed. And it's already on your bill. So I carried a bill this year. And I said, this will be shown on the patient bill because you are charging the patient. So the hospital CFOs came and said, well, we don't know how to really do this thing on the books. They could not explain. We asked them so many questions, and finally most of the people on the committee realized this was a scam. Because why you are not showing if it is a real thing? They could not explain to us. As I said, also the JBC staff told us that this is how it works. So basically now what it did to us, of course you know federal government never gives you money for nothing. So federal government said, if you want this $1, you will have to do Medicaid expansion. That's how we got Medicaid expansion in Colorado. Remember that? It was the hospital provided fee. So now, all you have to do is put 9 zeros behind this $1. That's how big it is. What is not? Okay, it's $1 billion. Close to that. That's how much money we are getting, because this $149 now has grown to close to $400. I think it was about $390 or something like that. So they are raising over $600 or $700 million. I can just never find the real number. Even the JBC staff can read that. But it is somewhere in the range of $600 to $700 million. So you can imagine that if we get that same amount back from federal government, the total has now become over $1 billion. Now, because we had to do the Medicaid expansion, that's a whole another story with it. Federal government says, if you do Medicaid expansion, we will give you the money. And you know there are most of the Republican governors who have refused to do that, like Bobby Jindal and so on. And all the Democrats have done this. Federal government is giving another close to $1.2 billion to do the Medicaid expansion right now. What that has done in Colorado, every other baby being born now is a Medicaid baby. We have added somewhere in the range of 300,000 people plus on Medicaid now in the last 2 years. Federal government is only going to give this money until Obama is in power. The way Obama has set all this thing up, a lot of this thing is supposed to either go down or disappear as soon as he's no longer the president. All this thing is good until 2016. Come 2017, this is supposed to go down by 90%. This one we don't even know what will happen. We'll have to see who is the president and who is in the Congress or the Senate. This means that now we will need $100 million because at $1 billion, 10% of that is $100 million that we will have to come up from the state budget. And Don just told you about the budget issues. That was another. Hospitals now are really concerned because where are they going to get the $100 million? Because the tax is not going to go down. And if you saw in the newspaper when Hickenlooper came out with his budget this week, he says that he wants to lower this tax by $100 million. And that's a whole other story because this thing is counted towards the state revenue because it actually goes into the state treasury. So now we surpass the table limit and all of you are going to get the rebate now. So they now want to turn this into an enterprise. They brought the bill in this year's session. Very last week they brought the bill. They got it through the House. We fought it on the House floor. I told them this is a tax and it's not a fee. And our speaker says, no, I took my oath and I said no. And I proved it. This is how I proved it. During the first year, when they got all this money, you remember that was 2008, 9, 10 years. Ritter took $100 million out of this federal match to balance the budget. The year I was elected, Hickenlooper took $75 million in his first year, $50 million in his second year. What is the definition of tax and what is the difference between tax and the fee? When this bill was passed, there was an opinion given by the Legislative Legal Service. If any money is collected, if it is used for a specific purpose, it is a fee. If any money out of that is used for general purpose to balance the budget, it is a tax. They violated it right here 3 times. It's a tax. That's why they want to quickly turn it into an enterprise. There is a lawsuit filed on 30th of June this year. There is a motion to dismiss the case by Cynthia Cochran right now. We don't know what it is going to happen. I hope that the judge denies the motion and we go through the case. Because this thing is going to take our budget down. If all this goes away in 2017, my concern is close to $3 billion deficit in our budget. We don't have $3 billion. That healthcare budget is going to kill everything. Education, prison system, anything is there. It will kill it. And people are telling me I'm crazy. I said, we'll see in 2017. But that's what is going on right now. So this is such a simple thing which most people have no idea. I found it out. The memo I found just by serendipity. I found the memo, and the memo says very clearly that it's a tax and it's not a fee. So they have already violated it. And now they are so concerned. So when the Hickenlooper came out this week that he wants to lower it, the reason he wants to do it so that there will be less revenue and he has to give back less money to you. That's the only reason he is doing it, because he wants to lower this revenue so we don't go over the table limit. And you can read, just go and go for the Hickenlooper's budget proposal and you could read all this. It just came out this week. So that's what is going on. There are so many other little pieces, and as I said, I hope Linda is going to show that slide again, and you will see there are so many things on it. You don't know where to start and where to end. So we will be talking more because this is coming. There will be a bill. We already know that they will bring the same bill again, and hopefully we'll kill it again in the Senate, and then we will be up for anything because then the president will be different. Hopefully Congress, Senate will be different, and all this is not going away. It's the numbers. Show me the money. That's all I ask for. If If there is money, I'm for it. But there is no money. There is no money. And lo and behold, if something else happens like 2008 economy, I don't know where we will. So thank you very much. And we will be around for more question and answer.